Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hello, I'm the weight loss champion, Chuck Carroll. Thanks so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And we remain in Rochester, Minnesota at the Lifestyle Pathway to Health and Happiness Symposium, and I'm joined by two people who are living and thriving with type 1 diabetes. With that, we welcome my friend, my hero, one of my idols, and an awfully handsome man, Dr. Brian Carlsen, back to the Exam Room. Thanks for being here.
Thanks for having me, Chuck.
And for the first time, registered dietitian Lauren Plunkett is also with us. Thanks for being here, Lauren.
Thank you, Chuck.
Brian, we've had you on the show before, so I'm going to start with Lauren, if you don't mind. You are also living with type 1 diabetes. We got Brian's story the last time he was here. I would love to introduce you to the Exam Roomies and hear about your journey with type 1 diabetes. Point of disclosure up front, you also work with another good friend of mine at Mastering Diabetes, Cyrus Kambata.
I do.
Yeah. So Cyrus, check your text messages. When did you first notice something was amiss with your health, and what got you to the diagnosis?
Well, I didn't sense the miss, but my parents did. So I was diagnosed when I was 11. And my parents had happened to know a couple whose daughter was diagnosed with type 1 diabetes the year before me. And the symptoms they knew were similar. So when they started to watch my habits of having to be really thirsty and peeing a lot, and I would come home from school at 3 p.m. and my snack was a can of Coke and a Crunch bar.
Oh, dear.
I craved sugar so intensely and I was losing a lot of weight. So they took me in. The next thing you know, we find out I'm not making any insulin. So it's off to the emergency room. I was admitted in the hospital for 3 days and then came home to figure it out myself and be a manual insulin delivery machine.
11 years old. Was that a scary proposition for you?
You know, because I've worked in the business now of diabetes education, kids tend to take the diagnosis much better than parents do. The worry, the parents think, gosh, if I could just take this on myself. They want to take it from the kids. But my dad and my mom, they were so wonderful. I'm thankful for having parents that said, you're a normal kid. You're not getting out of yard work. All of these kinds of things about you're doing the things that you want to do. But we have this thing that we have to work on, and it involves insulin and nutrition. So for me, the scary part wasn't the new job that I had. The scary part was what happened here.
What happened up there?
Well, in the beginning, it wasn't so noticeable, but I always say that what approaches after 11 years old is the hormonal apocalypse. So then, you're thinking differently and you're seeing your body change, and there's the comparison to others, which so many of us go through, right? Diabetes or not. But because I was doing the job of my pancreas, it really started to change my brain and the way I was thinking and having to worry about something all the time and not wanting people to see me test my blood sugar. And that was kind of this interesting upbringing of you grow up really quick when you get diagnosed as a kid, and you have to pay attention to things because you're taking a hormone that can kill you if you do it wrong. So every day is kind of this adventure in trying not to accidentally kill yourself with insulin. At least today, the technology is much better. We have so many safety nets now. But in 1993, and going into the late 90s, into my teenage years, it was a constant conversation, and how am I going to get through this today? And I always struggled to be an athlete. I really wanted to be athletic. I became very angry with things that I couldn't control. And so I would channel that into exercise. And so sometimes I was a good athlete, but sometimes I was really inconsistent. And that was now that I'm educated on this and I've grown into it, realizing that everything that didn't go well for me as a kid that I was frustrated about was because my blood sugars were so erratic.
Wow.
And I met with dietitians every year, endocrinologists every year, actually every 3 months, diabetes educators. And it took 10 to 15 years of that to find out about plant-based nutrition. And that was because I found out about it.
All right. Well, hold on. Let me bring that back, those 10 to 15 years, to when we're talking to 11-year-old Lauren here. Am I to assume correctly you were giving yourself your own injections?
Oh, yeah.
Holy.
I've been a needle pro for a long time.
Girl, at 11 years old, that's amazing. Was that scary for you at first?
Again, it was one of those things where I think it was modeling with my parents saying, we're not going to make a big deal out of this and inject this little tiny needle into the thigh.
Yeah.
I didn't give myself an injection in the stomach until I was probably, 18, 19 or 20 or something. I was scared of going here.
Work up the courage.
Work up the courage. But I could do the legs, and, things started to change when I got into my early 20s because that was when the rebellion really set in. But that ended up moving into, if I don't start getting healthier, the clinic's not going to do it for me. So here's the fork. You either get healthy or you don't. There's not another option in type 1. You got to take on.
Dr. Carlsen, let's do a quick reset here. And for those who are wondering what the difference between type 1 diabetes and type 2 diabetes might be, how would you explain that to the average person?
I would say that type 1 diabetes is an autoimmune disease where your immune system recognizes these certain cells in your pancreas as foreign. Those are the insulin-making cells, and kills them. And so that type 1 diabetes is a lack of insulin in the body. And the result is insulin drives sugar into cells. And so you have elevated sugar in your blood as a type 1 diabetic. Type 2 diabetes, you make insulin, and you may even make a lot of insulin, but the insulin isn't working well in your body. And that's because you've developed insulin resistance, which can be managed with medications and lifestyle changes, and very effective with dietary changes. Both of them have high blood sugar, and that's why they're both called diabetes mellitus. And there's other kinds as well, but it gets a little more complicated, but most type 1 and type 2 are the most common.
And people associate type 2 with diet very much so. We heard Lauren talk about, she was craving sodas and crunch bars. How much does diet play a role in the development of type 1 diabetes, if at all?
Yeah, you could say zero. A lot of people might say that. We do know there's something called diabetogenic cows, where they will have a virus in their milk, and so if you're exposed to that cow's milk, that cow's milk, you're at increased likelihood. There's also foods that can give you leaky gut and allow some of these animal proteins that your immune system can then cross-react in your bloodstream. So I would say the data is less precise and less clear, but I wouldn't say that diet has no role in the development of type 1 diabetes.
Maybe not in the development, but now let's talk about how it's actually helping both of you now thrive and live vibrant, healthy lives, because you're eating that way. So maybe the crunch bars and sodas didn't contribute to it, but it probably wouldn't help you very much if you were to do that today, Lauren.
Well, what's so interesting is that those kinds of cravings for those sugars, it's evidence of the cell itself isn't getting the nutrients that it needs. The cell needs glucose for power. The mitochondria needs glucose and nutrition for power. So if I had the inability, no beta cells, the beta cells make insulin, I was losing them. They were fried. If they're not hanging around to help move that glucose into the cell, they're kind of like your Uber, moving things into that cell, then the cell itself thinks it's starving. So my brain says, get the fastest acting sugar in your body as you possibly can. And that doesn't look right when a kid's losing weight and consuming the Coca-Cola. So that was, not ideal, right? But yes, moving into plant-based nutrition was a lifesaver probably for me. There was so much I didn't understand, so I thought I was a study of one the minute I started eating greens and stopped eating meat. But what it was evidence of is that people with type 1 diabetes can absolutely suffer and be dealing with insulin resistance without even knowing it. And that frustration is so high for people with type 1 because what happens is they go to the doctor and the doctor says, well, your blood sugars are not at goal, so you need to take more insulin when you eat. And what they've been recommended is probably a low-carb diet. So functionally, how does it make sense to not be eating enough carbohydrates, but somehow need to take more insulin every time you show up to the doctor? That's because the food that you're prescribed on a low-carb diet is causing the resistance in the first place. If you're not eating carbs, what are you eating? Protein and fat.
Right.
Where is it coming from? The meat and the cheese and the eggs and the foods that you don't think contribute glucose. So if we've got someone with type 1 that's dealing with that, the frustrations are unbelievable, right? I'm taking my insulin and exercising. I'm doing everything that I've been told, but why do I keep taking more insulin? Why am I told to take more and more and more, which becomes more inflammatory? So if we really look at what's amazing with reducing or reversing insulin resistance with type 2 or prediabetes is we can see that there's such a commonality there. That's why plant-based nutrition is epically amazing in diabetes in particular, because you lower risk for everything when you do that.
You mentioned protein and fat, and I'm just curious, is protein also a nutrient that you have to keep a keen eye on if you have type 1 diabetes?
Well, my answer to protein is always it's individually based. It depends on what kind of an athlete you might be. As a dietitian, I get really down to it because I love working with athletes. So I want to look at what do you need? What's a healthy body weight for you? What are you trying to maintain? Are you trying to build muscle? Where are we?
Right.
And you can get everything you need from plants. Every amino acid is in there. So we can definitely work through it with plants. It was something I came across on my own too, because I accidentally became more athletic after I went plant-based.
Accidentally.
Accidentally. I had more energy than I knew what to do with. And so I became an indoor cycling instructor.
Like spin class?
I teach 3 or 4 spin classes a week.
Oh, you're a little booty kicker. Man.
I yell at my friends for fun, and they pay me for it.
You yell at your friends for fun, and they pay you for it.
They do. They show up every week, and I keep asking them why.
Wow.
So we have a good time, and exercise is a personality a lot of the time. So we find something you love, and you stick with it. But I'm gonna get outside more this year. I'm not gonna stay in the gym the whole time. So I got the road bike ready. But yeah, so diabetes gave me life. Really, you think of it that way. Diabetes gave me life. Plant-based gave me purpose, and then it went from there.
Brian, would you ever pay to be yelled at? I mean, I know better things I could spend my money on.
How long are you in town for?
Oh, I don't know. Not long enough to get yelled at.
You would love it.
I'm not sure that I would.
My Tuesday night ladies, they'd be like, Chuck, we got a bike for you. There you go.
I mean, maybe. All right.
We have a good time.
Maybe.
We have a good time.
All right.
It's loving. It's loving yell. I always sign, if I send them an email, I sign your loving instructor. It's just.
Okay. Well, what if you yell positive messages in an angry tone? Like, you're doing great.
Right. Exactly. I wasn't too specific. I don't, insult.
Okay.
I'm nice about it. And I ask them, does the yelling work? And they often say, it does work. Can you be louder? And sure.
I don't know. Maybe be like a positive drill instructor. I don't know. That's kind of cool.
I never cheat. I do it with them. So.
Okay.
Yeah.
You're not asking them to do anything that wouldn't
exactly.
yourself.
If I can't breathe, I know they can't. So I'm not going to ask them to do anything I can't do.
Makes the idea a little bit more palatable, Brian. Let's try to get this interview back on the rails. There is a plate of fruit right in front of us. We've got bananas there. We've got a nice mandarin orange. We've got an apple there. Brian, a lot of times people, who are diagnosed with diabetes, one of the first things they're told, cut the fruit out of your diet. Sugar, carbs, just no good for you. What would happen if you were to eat the banana, the apple, the orange?
Me personally?
You personally?
Very, very little would happen to me. If I ate all of that, my blood sugar would definitely go up.
Right.
Yeah, we do still need to count carbohydrates, but the amount of insulin we need for those carbohydrates is a lot less. And that has changed a lot. So before, to eat a banana, before I went plant-based, I'd have to give one whole unit of insulin for one banana. Now I could eat 3 bananas or 4 bananas and take 1 unit of insulin.
Is there still an adjustment period with that? If somebody were to transition to a whole food plant-based diet overnight, does the body need time to kind of re-regulate itself, so to speak?
We're regulating it for ourselves, so it can be scary. And this all came as a shock to me, I think for Lauren as well, when we changed our diets and we I didn't know I thought maybe my diabetes was cured. All this other great stuff was happening. And I thought, well, maybe I'm cured. This would be really great.
Yeah.
I wasn't cured, but I just became very insulin sensitive. And this is what Lauren does. So she will have stuff. This is what she does in her day job.
It's carbohydrate tolerance. So you don't just walk into a plate full of fruit and expect nothing to move. It's, as you had mentioned, this baseline of if you don't know that you have insulin resistance, going straight into something that's high in carbohydrate or that's new to you as being high in carbohydrate, it requires some patience. It requires some insight onto how your blood sugar how the pattern of your blood sugar works over 24 hours. for example, for me and for a lot of people, very common in type 1 diabetes is I look at 6 a.m. to 12 p.m. We tend to have lower sensitivity at that time in the morning. After 12 p.m., our sensitivity tends to increase. So fruit is really intimidating for people to go into. By the way, natural sugars are nothing to fear. So if we're looking at fruit and we're afraid of it because we've kind of learned that my blood sugar reacts really quickly, is what time of the day are you the most sensitive? That might be the right time to start something like fruit. Let's see how you react to it. Let's see how you do with half of a banana. Then you go for a walk. Let's see what your blood sugar does, because we don't want to induce more fear where there's already like curiosity and doubt. So if we go careful with the carbohydrates, high fiber, mixing our fruits with like leafy greens that slow things down a bit, slow down the absorption rate, we can start building confidence in these fruits. And that's how I play with them. I might do a half of a banana in the morning before I go to teach, just to see like, am I going to react with this? Because every morning can be a little bit different. The hormonal cycle is tons of fun for women. So that's one thing that we have to think about with fruits like this. But I mean, I think I ate like 3 cups of berries yesterday. So like you put blueberries in front of me, they're gone. And
Gotcha.
So,
That's your
but I've
kryptonite.
worked into this.
I mean, that may be the healthiest kryptonite ever.
Well,
I mean, come on. Blueberries?
that's just one example.
Okay.
I probably have an appetite like you do. I mean, honestly,
This is ravenous.
you've got a foot on me, but still, yeah. I mean, it's like when you're active, but when you have diabetes, you want to go into things gradually to figure out how it works for you and how much you enjoy it. And you start small with plant-based. You kind of start exploring the outer ring and then the next outer ring, so you become more adventurous. But blueberries, they're just one of many.
Gotcha. Dr. Carlsen, Lauren just mentioned exercise here. How does that help to regulate your blood sugar levels as someone with type 1 diabetes?
Right. It definitely has a dramatic effect. And it can be scary at first when you're not, how do I exercise? I want to run. Every time I go running, my blood sugar might drop. For example, that's not an uncommon experience for type 1 diabetic. And this is not what kind of doctor I am. I don't work with type 1 diabetes management. I just know myself.
Yeah.
But I know, and Lauren said in her talk earlier today, exercise every day. It's not an option. It's something we do. We have to do. I don't take rest days. I take easy days and hard days, but I don't take rest days because I'm accustomed to it.
Yeah.
And so for me, I know, like I get up in the morning, I go for a swim, I eat 1 banana before my swim, and I never have an issue. I come out and it's good. And a consistency with a lifestyle is really important. So like Lauren said, if someone is new and figuring it out, it can be a stepwise process, and you have to be patient with yourself. Yeah.
Is there a one-size-fits-all diet plan for somebody with type 1 diabetes, or is it very much that individualized thing that Dr. Carlsen was just referencing?
Well, there's always a reason to become individualized, always. And it's based on someone's schedule. What are non-negotiables in your life? Fasting is great. There's science to this, but not everyone can do this. It doesn't work with their schedule. Mm-hmm. So the one-size-fits-all approach can say fruits, veggies, beans, whole grains, nuts, seeds. Yes, okay, I teach fiber forward. So if we can just start there, now you can start to design an eating plan that really works for you. If we go into the fiber, we really just lean into it, because all of these wonderful accidental things happen after that. But going into the communication with saying, where does fiber live?
Right.
That can be the first thing that's hard to identify. And then the questions begin, like, but that's high in carbohydrates. But isn't that a starchy veggie, and I shouldn't be doing that? But beans? I've eaten beans for 10 years because I thought they were high in carbohydrates. So what happens with diabetes is an incredible amount of troubleshooting in the process of it becoming individualized. And the biggest thing in diabetes is to simplify it back, because someone could have years of diet programming, years of it, lifelong dieters by the time they're diagnosed with prediabetes or type 2. And if someone's ready to say, no way, I'm reversing this, and they're jumping in with 2 feet, it's my job as someone who's a coach, a diabetes educator, to say, here's where you came from. Diabetes is not an overnight diagnosis, either is the reversal. So we can individualize with a lot of the same grocery lists, but how realistic is it for
Right.
you to live this way?
Right.
And we
Right.
go from there.
And with, I guess, using that to kind of frame this next question, I mean, with diabetes, it sounds to me like you just kind of alluded to, this is not one of those conditions where you want to go cold tofu, as they say here on the show, and cannonball into the deep end. You really do have to gradually get yourself there. Otherwise, there could be some complications, correct?
Well, I don't think either one of us went. So, no, you did. You read the book,
Did
and
you go?
by noon you were plant-based.
And
Just flip the switch, huh?
Yeah.
yeah, it was, I don't recommend, I like the idea of going all in I don't think it's a good idea for type 1.
Right.
And it would be scary for me to counsel that even for type 2 if they're on glucose lowering medications. I love it for people that really want to see a dramatic change. If you make a small change, you'll see a small change in your body, and that if you stick with it and gradually increase, that works. With people like me, and I know Cyrus is like this too. We're like all in when we do stuff.
Yep.
And if you have that personality and don't have these cautions, those people will see a very dramatic effect, and you don't need to read the science or a book or get on Instagram or whatever. You just for yourself how powerful the food is working in your body. So
I had no idea what was going to happen. For me, it was 2009, 2010 that I really went all in. I'd been dabbling. I remember the last time I ate a cheeseburger, and then from there it was just like less meat, right? But then adding the plants, I was exact same. I thought, I'm a study of one. I have figured this thing out because I went to the endocrinologist. I have all these low blood sugars happening because I was becoming more sensitive. Didn't know why. She said, just, keep doing what you're doing. I'm dropping your insulin. So let's just see which direction we go in. So from there, it came into, now I can add more. So it was the variety that became the fun part of food, because I'd lived this life of carbohydrate fear and restriction for so long. And now all of a sudden it's like, what is happening here? Like, there isn't anything I can't put in this bowl that isn't a plant and have a better outcome that's more predictable. And it's giving me the energy that I haven't had. So I'm sticking to it. It was kind of how I felt.
Right on. How many units were you using initially, and how many are you using today?
I think my high point was on an insulin pump that was really a bad situation. Actually, it was a device that really didn't work for me, and this was a while ago. But I think I was somewhere up in the 60s or 70s a day of total daily insulin, and now I can be anywhere usually between 25 and 35.
I cut it in more than half.
You cut it in half, and that was, I think maybe I was even higher initially. It was one of those things where I feel like it's a blackout in my memory of times that were so bad that you kind of put that safety space, that safety box in your brain of like, I don't want to remember all the things.
Yeah.
But when I published a book of my story, I had to tap into that stuff. I had to tap into that chest that I had shut to bring out, like, this is really the difference that it made for me from 11 to becoming a professional. And it was, I think there's a point now where there are little things I could do to become more insulin sensitive, but my quality of life and where I am right now, the stability of that with how I can exercise and like trust it is really like, I'm good. A1C I'm happy with, like, we're good
right on.
Here. Yeah.
What about you, Brian? What were your numbers?
Very similar. I was right around 50 at the most, and I know because I did a similar thing. Dr. Barnard actually asked me to write. We wrote a little case series shortly. Well, I don't know when. My memory too. It was a couple years maybe after, so I did have to go back and get all those numbers and see what my A1C was at these time points. But it was about 50 something units, and then now it's between 25 and 28 units per day.
Another big drop.
And it's a big, it's like cut in half, and then but eating 3 to 5 times the amount of carbohydrates in a day. So if you do the math, it's somewhere, but some actually were between 5 and 8 times the ratio between carbohydrate consumption and insulin use. Yeah.
He's probably the most insulin sensitive person with type 1 I've ever met. quite honestly.
Hey, there you go.
I think
should
you
get you
There we go.
a badge.
Yeah.
No, something to pin on you.
Your ratios are.
It is a little bit scary. It can be a little bit scary because you have to measure up these very small fractions of insulin. That's really the only downside. I do wish you could, especially as I'm getting older, my eyes aren't as good. I have to take my glasses off or contacts off and to dose the insulin. Yeah, it can be a little tricky.
Glasses on. Yeah, just don't try that at the DMV, as you were telling me.
Right.
What is the name of your book?
Type 1 determination.
I like that. Type 1 determination. Okay, available on Amazon?
Yep, Amazon, and I ship it straight from my house. I sign every single one of them.
Oh, wow. Okay.
Yeah, independent publishing. I wanted control of everything. Can you imagine? But yeah, it has their fiber is my favorite F word is one of the chapters. Candy and cola cola and candy bars is another chapter in there. So I wanted to use my childhood voice in the beginning to tell the story, but I drop in my professional teaching moments in a box in between to kind of explain like what horrible thing was I going through at that moment, because that was the missing piece of being able to stick with what I had learned about plant-based nutrition, exercise. Like, what is all this stuff that's happening to me that no one's ever explained before? Is now I can explain it. Now I can explain what I was going through when I was an angry teenager, the hormonal apocalypse, the 20s, the self-doubt, body hatred, body dysmorphia, like all of these things going through. Like, I can't fix this.
Yeah.
How am I going to work through it? I can't cure this thing. How am I going to embrace it, move forward, and working so much through mindset. I preach to the choir on like the mindset of these changes and how to, get forward with that. And body positive is it never stops being work. Type 1, it never stops being work. And we get like the compassion and empathy we have for each other as a community is amazing, because we know it's like these hard days that happen. So I really wanted to focus on that in the book. And then I have a little blip about nutrition and then another piece about exercise. And it was talking about exercise in a way where it really gave me life, and that it's a personality. We don't have to exercise if we hate it. We need to find the movement that we love. And that's it.
That's why I'm wary of your bike class, your spin class. I just don't know, man.
Don't I seem like fun?
You seem like a blast, but I don't know. It's, I don't like being yelled at. I'm a gentle soul.
I will change for you. I'll give you one class.
She will change for me for one class?
Mm-hmm.
All right.
I'm a coach. I can work through this. But the last song might be different than all of the songs leading up to it.
Oh, what song is that? Because now you're talking to the old music DJ. All right, so you lay it on me. I got my start in music radio. Let's go.
Grace Potter.
All right.
The Lion, the Beast, and the Beat.
I don't know that one. I never talked that one up.
I listen to that song before I give every presentation.
Okay. Grace Potter. All right, we'll link off to that on Spotify too. Yeah.
Oh my gosh, I could get it out right now.
All right.
Probably can't play music.
Yeah, we don't have the rights to it, so yeah. Save that for once we cut.
Yep, don't tell on me for playing that, but it's nonstop in the studio. It's a good
all right,
one.
It's on loop. All right. Dr. Brian Carlsen, Lauren Plunkett, thank you very much for your time. This has been fun.
Thank you.
Thank you.